All right. Hi, everyone. Thank you for coming out to our events this week. We have these events every week through Students of Dentistry, so you can stay up to date on our Instagram page. So today we have Dr. Graves, who is going to present a presentation, but feel free to ask any questions in the chat or unmute yourself if you have any. So I will throw it to Dr. Graves.
All right, guys, thanks for having me on here. Let's do a couple of different things. Let's do two case presentations. We have a special guest here, a guy that I did surgery on who's actually in town. We can drag him up here. We've become friends over the last couple of weeks. He flies in and out from like California. He lives in Beverly Hills part-time. He lives in Sedona, Arizona part-time. So he flies in from those two places. But it's kind of a unique thing. He flew in today and he got his final set of teeth this afternoon. He actually appeared on the news with me this afternoon. So I drug him down there to do a little PR with me. And he's staying in my house tonight and he's leaving tomorrow. So we kind of have a unusual situation where we have a guy that I did surgery on, and it's a relatively big surgery and it's a very expensive surgery that you guys can ask questions about his experience if you want, whether he thought it hurt or didn't hurt, whether it was worth the money. I mean, you can ask him anything you want to. There's no restrictions when it comes to me. You're not gonna hurt my feelings either way. I'm pretty confident he's gonna have all positive things to say because the surgery went great. But first thing first. So I'm gonna give a presentation of a guy who I did surgery on about a year and a half ago. It was actually filmed at the time for TLC. So TLC from New York, Brandon, they came down, they sent a crew down, they filmed me doing this guy's surgery, and it was a part of like a pilot series that they were doing. It was centered kind of around my office. The name of the pilot was Save My Face, ironically. And it never really got picked up. It made it pretty far. It was between our show and another one, and they picked the other one, which failed miserably. But I'll do the presentation real quick. Then I'm going to show a video of a lady I did a similar surgery on Frank with, and then maybe I can drag Frank up here. We're going to ask some questions, and that'll probably drag us into around maybe 45 minutes, kind of like a good ending point. Okay. And as I'm doing this presentation, you guys can butt in and ask whatever questions you guys want about it. Okay. We have a kind of a small, intimate group here, so not a big deal. Okay. All right. Let me pull this up. So hold on real quick. So originally I did this for McGill University. I haven't changed it because I didn't realize I was going to use it. So just kind of ignore that on there. You guys can see this okay?
Yes.
Okay, good. Okay. We'll quickly go through this. I mean, we have an oral surgery resident here, and you guys seem to be pretty versed in the dental world. But I'll kind of go through a little bit of kind of the training that I have and the training it takes to be an oral surgeon. Obviously, you need your 4 years of undergrad, and then you need dental school. And that's where I attended the University of Louisville for dental school. And I graduated there in 2004, which is maybe before some of you guys were born, unfortunately. But no, you guys are in college, right? And then I did my residency at the University of Tennessee, and I finished that in 2008. And following that, I built a practice, which is Amarillo Oral Surgery, and I did that in Amarillo, Texas. And and I'm not from Texas, I'm from Kentucky originally. I didn't know a single person in Texas when I moved to Texas. Finishing my residency, I just knew I needed to go somewhere. I wanted to start my own practice and kind of do my own thing. I had my own vision of what I wanted to do. So I just started researching around the country, and I probably researched maybe 40 or 50 cities. And I probably visited, I don't know, maybe 10 places, which is tough to do when you're a resident because you don't have a lot of free time. So it was quick trips back and forth. And I really came down between two places. It was a place called Bend, Oregon, and Amarillo, Texas. And ultimately I chose Amarillo over Oregon. And did that in 2008. About 7 years later, We opened our brand new facility that we have. It's about 17,000 square feet. It's the largest oral surgery facility in Texas, and it's about the second largest in the United States. I think there's one in Atlanta that's a little bit larger than our facility. There we go. We're a certified surgical center. So there was an extra certification that we did. We have our own OR in our facility where we do surgeries. We bring anesthesia providers in. We intubate patients. We do rather larger surgeries, similar to what you would do at a hospital. Anything that's kind of outpatient, we do at our facility. And outpatient meaning that the patient doesn't spend the night at the hospital. You do the surgery, they go to a recovery room, and then they're discharged to their house. This is like a bird's eye view of our facility that we have right here. A couple things I did is we have a charging spot. So in 2015, when we had like an electric car charging area, we were the first people in our entire city that had an electric car thing. You see them all the time with Teslas. I actually have a Tesla. I think I bought it 2 years ago, and there was like 2 other ones in the city. And now, I mean, I see them all the time, and I'm sure with you guys as well. But we're trying to be really progressive. If you notice, we put our logo on our roof of our building, because I just assumed at some point everybody's going to Google Earth everything. And I just wanted everybody to see our logo when you did that. So it's another thing that I did. We can change the colors. We have these LED lights, and it allows us to change the color. So if it's on Valentine's Day, the building is pink. If it's on St. Patrick's Day, it's blue, and 4th of July is red, white, and blue. And since I'm from Kentucky originally, that when Kentucky's playing basketball, it's blue. So I kind of, and honestly, if you guys have been to Vegas, right? Anybody been to Las Vegas? So I was in Vegas when they were building the building. I was walking down the strip, and I saw the MGM Grand, and it's all lit up green. So I called the architect. I said, look, we got to make our building look like the MGM Grand. And this was how we did this. These are just some like beauty shots of the office. It's like the front desk. I have this real modern contemporary style about myself, but I also like Americana kind of stuff. So I have these images, and this is one of them right here, these black and white photographs from the Library of Congress of these historical medical things. So this is an ether dome from Philadelphia back in 1910. And this is in the old days, before, when anesthesia was just now, becoming a specialty. They would go in there and they would do these big procedures, and these doctors would come to these auditoriums, and you'd watch these live procedures. So I enjoy like this Americana and history involved in medicine and dentistry. And you can see a lot of that stuff reflected throughout my office. We have classrooms. We have a huge classroom in our office. I have a OR that has a camera in our OR. So I can do surgeries, and we'll have like the universities, they'll send their classes, and they'll sit in this classroom, and they'll watch me do the surgeries, which is in the room next door. And we also do like CE courses, and we do all the CPR and first aid for all the dental offices in our area. We have a big conference room where we do other things. And here's another example of like the black and white Americana stuff that we have. This is our electric car parking spot that I was telling you about. Everything we have is custom made. Like this little car graphic thing right there, that's a custom made thing. Like we have a full-time graphic designer in our office. And a lot of that's based on our social media. We have, in the total company, we have about 160 employees that work for us. We have about 10 people that do nothing but like graphic design and social media and video editing. We have a whole department like dedicated to that. So everything we have, I kind of run through the graphic designer, so that everything's kind of customized. There's not really stock images or anything. Here's a photo of the OR. It's kind of changed over the years. This photo is a little dated. We have some more updated equipment, but this is essentially about the same size as most of the ORs that you'll see at the hospital. So we do Botox, we do fillers, we do facials. We have a full-time esthetician that works at our office. I used to do a lot of the Botox and fillers, but I mean, it's so busy now that I hired a nurse, and the nurse does the majority of that. We probably see about 100 patients a week that come in just for Botox or fillers and lips and everything else you can think of. Um, we have a entire wall, and this is my personal office. And I don't know if you watch the social media, but we have the sign that's above my door at my office that says "Operate like a champion." And it's kind of the old Notre Dame theme where they walk through the tunnel and there's a sign that says "Play like champions today," and everybody touches that on the way out to the field. And this is kind of our own version of that. Is this is operate like a champion, and the thought is that in the morning we touch that sign to start the social media every single day. So it's not necessarily me, but someone at the office touched that, and the whole theme is, okay, the day is starting. Let's all go out there and we'll operate like champions today, and that's the theme. So I had this artist come in, and I said, look, I had this big, huge wall, and that wall, you can see how tall it is compared to that guy. He's about 6 foot. And I said, look, I want this sign floating through space, and I want an astronaut touching it, and I want a beam of light coming from Amarillo on the Earth, and I want a tooth constellation. And like 2 weeks later, this is what I got it. This is what happens. You know what I mean? And all that, this guy's all hand painted. This guy took like an iPad and one of those little airbrush guns and painted this whole thing by hand. Kind of goes into a little bit of my personality. I kind of have like I'm a little quirky when it comes to things. So continuing with the practice. So we built that big building, 2015. In 2016, we decided, and we do a lot of pediatric oral surgery. So in 2016, we said, you know what, let's just start our own pediatric dental office. So we established this ALMS pediatric dentistry office in 2016. After that, we expanded the practice up until Oklahoma. So this was our second location that we had, was in 2016. Shortly after that, we expanded up near New Mexico for a third oral surgery office. In 2020, we established our own dental office. So we were doing oral surgery, we're doing pediatric dentistry. We said, you know what, let's just start doing our own dental office. And this is a little bit outdated. We have about 15 locations now. We have about 15 doctors that work for us. They range from, and we just hired an endodontist that does root canals. So we have one endodontist, we have about 5 pediatric children's dentists, and we have about 11 general dentists that work for us. We have oral surgeons, we have CRNAs, we have anesthesiologists, we have nurses that work with us, and we're slowly expanding. Not slowly. We went from about 35 employees before COVID to about 160 employees now. So throughout COVID, even though the dental offices decreased in volume, the total business really boomed during that time. Like I said, this is summary. This is lecture's a little bit old. We've grown a little bit more since then. But if we're going back to like oral surgery versus dentist, like what's the difference between what an oral surgeon is and what a dentist is? And education, we both get bachelor's degrees. We both go to dental school. After dental school, that's kind of where you see the separation happen. Oral surgeons go to a 4 to 6 year residency program. In addition to dental school, some people get their MD and some people don't. Like we said, at the end of the day, you're basically doing the same thing in private practice, and you're basically doing the same thing at the hospital. Maybe the only thing that maybe would separate the two is if you wanted to go into academics, potentially, maybe the MD would be of more importance than having the single degree. But if you look at the pioneers in oral surgeon, there's Dr. Marks and the big name guys who do all the cancer research and who've really pushed the specialty to grow. The majority of those guys are single degree guys. So having that MD doesn't really allow you to do more than you could without that, with your single degree. But like I said, it's not a bad thing to have the extra 2 years. And the difference is when you're a dentist, everybody knows what you do at the dentist. You have fillings, you have crowns, they do root canals. Dentists do take out teeth, and they can do wisdom teeth, but they'll never do as many as like the oral surgeon will. And I do about 8 sets of wisdom teeth every single day, and most dentists in a busy practice, maybe they do 3 or 4 in a week. So in my opinion, oral surgeons, we become very efficient at doing the wisdom teeth compared to dentists because we do so much volume. we're probably a lot faster at doing the surgery, and we probably have a lot less complications doing the surgery than if you were a dentist and you were just doing a couple. And that's just basic math. You can't be perfect at everything that you don't do a lot of, right? But in addition to like the normal dental stuff, we do facial trauma. I've done 2 mandible fractures this week. We do pathology. I did a couple tumor resections, but big cyst removal this week. We do orthodontic surgery, which is jaw surgery. We work at the hospital. We have privileges at the hospital. We're the only specialty in dentistry that can have admitting privileges. If you're a pediatric dentist or another type of regular dentist, you're not allowed to admit your own patients to the hospital. You have to get help from a physician or MD to do that, versus as an oral surgeon, we can admit all our own patients. We kind of work independent among ourselves and compared to the rest of the hospital. So speaking of tumors and pathology and stuff that we do as oral surgeons, here's a quick little case presentation. So I have this guy that comes into my office, and his chief complaint is he has this big, huge tumor growing on his face. So he's a 64-year-old guy. Tumor has been growing rapidly over the last couple of years. There's no numbness associated with it. It's not causing any difficulty eating, but it has a lot of psychological effects on him, and you'll see that here in a second. His past medical history is not significant for anything. There's nothing here that's going to explain why this guy has this big tumor on his face. And there he is. So this is Charles. Huge tumor on this guy's face. You notice his t-shirt's cut right there, and that's purposely done by him so he can fit his shirt over his head to get around this tumor. Here's a CT scan of it. So that dark area, we refer that as being like a radiolucent area, which means that area is not very dense and the beam of the radiation can flow freely through that. Versus if you look next to that, there's the white area where his spinal cord is. It's very dense and it shows up very white. So whatever this is, it's not very dense. So it's fluid filled or fat or something in there. So, just based on this and clinical exam, it's going to be either a lipoma or it's going to be a liposarcoma. Unfortunately, lipomas typically don't get this big. They're very slow growing, and it would take this thing 100 years to grow this big. So it's probably going to be like a liposarcoma. And depending on what type of liposarcoma, it could be very, very bad, or it could be not so bad for Charles. So our plan on this guy is we're just going to excise this tumor. And we end up taking this out in one surgery. Sometimes people ask, why didn't you do a biopsy of this first and get a diagnosis and then go back and try to do it as a second surgery? And the reason we didn't do this is when you do these big lipomas or these big tumors, you really want to get a biopsy from like the center of it. You want like a core biopsy of the tumor. And unfortunately, sometimes something this big, just because the blood flow is not great in the middle, that you have a high infection rate when you do that. And I was pretty confident it was encapsulated, which means it had a shell around it that we could just remove the whole thing in one surgery. So we decided to do that. Plus, there's other reasons for that with Charles. We'll talk about that in a minute, that we decided to do this. But here's a couple of still photos of the surgery that we did. You can see me holding the tumor over there on the right side. That camera was one of the cameras that the film crew had set up when we were doing the surgery. And there it is. There's the big tumor. We actually had to go to the hospital and get a special sized bucket to put this thing in because it wouldn't fit in anything that we had. And I actually drove around with this thing in my car for about 2 days because I did the surgery on Saturday. So to kind of give a background on Charles, is part of the reason that Charles had this tumor on his face for so long was he didn't think he would take it out, for one, and he didn't have any money to take it out. So he went to one of these free clinics and they saw him and they referred him to our office. So Charles came in and we just did the surgery for free. It's not every day that you see somebody with this walking in your office with this thing on their face. So, it was like kind of once in a lifetime surgery for me. I'm never going to see this case ever again. I mean, there is some compassion to Charles. We wanted to help him out. He needed to have the surgery. So we said, you know what, we'll just do this for free. So then I took a picture of this and I sent this to TLC, and the guy from TLC was like, we'll be there tomorrow. We're like, well, yeah, we're getting on a plane. We're going to film this thing. We'll be there tomorrow. We want to see this. So he allowed us to film it as well. I did it on a Saturday in my office just because we were doing it for free. The hospital was closed on Saturday, which is the reason I drove around for 2 days with this thing in the front seat of my car before I could take it to the hospital. It ultimately came back as a liposarcoma. It was a very rare form of this liposarcoma. He didn't need radiation or chemo for treatment of this. The treatment for this was just surgical excision of this. It has a very good 10-year survival rate, extremely low metastasis rate. The curative rate of this is just removing the tumor, which we did. He's on follow-up, and I've seen him about every 6 months, and it hasn't recurred, and he's doing fine. So here's come before and after of Charles right here. Social media. Let me see if I can find this video of Charles real quick. I'll play for you guys. You guys still there?
Oh, yeah.
Oh, yeah, good. Okay, good. Stop sharing. Okay. Play Charles' little video right here. If I can find it on here. Okay. All right. Can you guys see this little video right here?
Yep.
All right.
And I can't get back to sleep. And then just scratch, and it don't hurt. And then I never feel it, just never give me no trouble.
Charles Hall is my ex-husband, but we are close friends still.
She takes me places and do things, and if I need some help, she helps me. See, other than that, they just the same old thing. This mom will be mad again.
I have to get most of his shirts, and I have to cut them, like right here. And I have to cut it so that way it'll fit over his head and with that big ball.
As you scroll through it, you can notice, this tumor is about the size of the rest of his head. So if you were to measure this area right here, that's about the size of the rest of his face. Just this extra growth of tumor he has right here. So this is all grown this size in 1 year?
Yeah.
Does it hurt?
No, it doesn't hurt.
You got any numbness anywhere?
No.
Can you feel me touching right here?
Right there.
The thing that concerns me is as you kind of scroll down on the CT scan, this thing really goes pretty deep into its neck right here. Typically lipomas don't get this big. And if they do grow this big, this rapidly, they're typically a liposarcoma, which is the cancer version of what a lipoma is. Charles, do you have any questions about anything for me?
No, I don't think so. I'm ready to eat.
You ready to eat?
Yeah.
Yeah, I bet you are.
I am, but I'm hungry. I'm looking forward for surgery tomorrow, and I'm just looking forward to a good day.
by far the biggest one. Jeez. All right, here's our final weigh-in on our lipoma. Looks like we're at 3.6 pounds on this lipoma, which could be the world record for a facial lipoma. I don't know if that was a world record or not, just for the record, right? But I mean, it wouldn't be safe for the TV show, but it has to be close. I mean, we did research and we really couldn't find anybody with bigger facial lipoma than that. I mean, they're not very common that you see those things. So that was the lipoma case, our pathology case. The other case maybe we can talk about is we do this surgery. It's called an all-on-4 surgery. That's kind of the popular name for it. We have our own little version of it. We call it the 4-hour smile that we do. And it's about a $50,000 surgery. And basically what you do is you go in and remove all someone's teeth. If someone has bad teeth or non-restorable dentition or their mouth's not restorable, we'll go in and we'll remove all their teeth and then we'll place dental implants all at the same time. And then we actually have the lab make them teeth. So you go in from either having no teeth or really, really bad teeth to having like basically perfect teeth in one day. And, you know, we do the surgery maybe 4 times a month when we do it. So it's a long procedure. It's a long procedure for the patient. The video I'm going to show you is we have a program at our office. It's called the Smile Again program. It's where we take somebody from our community and we do it for free every year. So we do one of these for free every single year. And we've done that for about the last 5 years. And the video I'm going to show you is actually the lady that we did the surgery on for the very first one. Her name is Ruby. It doesn't show a lot of the surgery, but what it does show you is how this surgery really impacts somebody's life. I mean, this is Charles's surgery is life-changing. I get it. And the fact that, you know, Charles has been dealing with this for 2 years, it's a little bit embarrassing for him to go in public. People kind of point and snicker when they see a guy with that facial tumor walking around, versus the video I'm going to show you of Ruby, who has bad teeth. She's had bad teeth for her entire life. So this is something that's been bothering her for the last 40, 50 years of her life. And this is more of a dramatic, life-changing thing because she's really changed the way she's lived her life because her mouth is so bad. So let's watch this video, and then I'm going to bring Frank up here because Frank had a similar surgery than Ruby did. And, you know, Frank was dealing with a lot of issues with his teeth. He speaks publicly for a living, and that's how he earns his living. So he's used to having large audiences of thousands of people staring at him on a stage and on camera. So he's much more aware of the impact of his teeth to other people versus a Ruby who just secluded herself. So let me play this video, Ruby, and then maybe we can get Frank up here and we can ask him, or you guys can ask him some questions. So hold on real quick. Can you guys hear this okay? Hear the video? Okay.
Yes.
Okay.
In 4 hours, your life is changing, Ruby.
I really don't know what to say, really. I'm so nervous.
You know, when you see Ruby, you can tell she has like a glow about her. There's something special about Ruby. So Ruby comes in
And you can tell right away that Ruby is a good-hearted person, but at the same time, you can also tell that she lacks a lot of self-confidence.
Your first impression, your smile is everything. And when you're not smiling, it takes away. I wasn't able to smile and I wasn't able to be myself. And in a few hours, I will be.
The whole concept of the Smile Again program was we wanted to find a way that we could give back to the community. And as oral surgeons, we do these radical reconstructive cases that change people's lives. And what's not a better way to give back to the community than take someone from Amarillo and do a surgery on them that's going to change their life forever.
Um, I woke up, I had a brand new smile. It just felt wonderful that I could smile.
We thought she'd be a great person to give this gift to as a thank you because we know that there are thousands of Rubies in our community who are single mothers who put their kids and grandchildren first and they neglect themselves.
I never felt comfortable taking pictures. So, I wouldn't take pictures. Um, if I did, I didn't smile. I did a little smirk. I always held my mouth just right because I knew that if I smiled too big, I would show my teeth, and then people would see my smile.
One of the things that really touched us was Ruby would never take pictures with her family because she hated her smile.
All my kids and family would get together and we got to take pictures. Sometimes I would just step back and just let them take pictures and have fun.
By giving Ruby this new smile, we hoped that she would finally feel comfortable in her own skin.
It opened up so much more in me, that, I can, when I see strangers, when I'm walking in the store and stuff, I smile, and they don't even have to smile back at me and say hello to me. It just makes me feel good. I know I got a pretty smile now.
Everyone here at AOMS is so happy to see you smile again, Ruby.
I would like to thank Dr. Graves and his wonderful staff for choosing me. Thank y'all for showing me so much love. Thank y'all. Yes. I'm getting emotional. Sorry.
So, I like to show that case. I mean, I'm so critical. That was like a long time ago. So I'm real critical about video, me on that video. So it just gives me goosebumps every time I watch it, and it drives me nuts the way I'm using my hands and I talk. But I still like to show the video because I think it's a good illustration that, if you become a physician or a dentist or an oral surgeon, that you really have the ability to change people's life. And, it's not about the money. You're going to make plenty of money doing what you love. It's about making these impacts on people's life. And to me, I get so much more joy out of doing a case like that for Ruby or for Charles with the tumor than I'm ever going to if I do a good day production. If I make a lot of money that day. And it's really not about that. And I think it's good to remember that. And I mean, this is my way of impacting and changing the world. I mean, I come from a poor family. My mom worked at a gift shop and my stepdad drove a truck for a living. I mean, we didn't have any money. I didn't know what rich people were back then. So this has given me the ability to make, changes and affect people's life that if I wasn't an oral surgeon, I didn't go to dental school, that I would never have ever done before. So I think it's always good to remind people that, you know what, that should be a big focus of why you do this and what you want. And I realize when you go to dental school or medical school, you're going to say this in your interview. You're going to tell them that you want to be a doctor because you want to make a difference and change people's life. It's important that you don't forget that and you continue to do things like that. So anyways, I have Frank here. And it's good because I didn't do Frank's surgery for free. You paid for it, so that's good. And he's not a free guy. Come on in here, Frank. Let's talk about it. So Frank just got his teeth today. So these are a brand new set of tires on him. And we went out to dinner, and I can verify that they work. You know?
Yeah, they do. They work very well. That's right. As I told him earlier, I think that God should take some pointers in his creation of dental work.
So, Frank, he lives in Sedona now. He flew in from Sedona. He's been flying in from Beverly Hills. And you guys have any questions that you want to ask Frank? I told them they could ask you anything they wanted to, or you could maybe talk a little bit about your experience if you want to.
Well, we could go. Hi, nice to meet you. Do you have a question? If not, I certainly am not short on oratory.
Yeah, and Frank talks publicly for a living, so whenever
privately.
Whenever you need to cut him off, if this is going too long, just kind of do one of these, and he can wrap it up. Okay.
Or you can do what they used to tell me in Brooklyn, which I can't mention because we're in mixed company.
Frank, welcome. Thank you for coming and joining us here today.
Thank you. Thank you for inviting me.
Can you tell us a little bit about the experience that you've had as far as being in public speaking, changing your appearance, changing your smile, changing your confidence? How has this gone from the beginning to now?
Well, first of all, I had become very self-conscious. I grew up at a time when people didn't really pay a lot of attention to oral hygiene and oral health. And, my parents immigrated from Europe after the war. Well, you guys are young, the Second World War. There's been a few since then. And that wasn't a priority, and so little by little, my dental health deteriorated to the point where by the time I met Billy, I was already on the speaker circuit, because of a documentary I did, was the subject of a documentary. And I was always really self-conscious about it. But not only that, because the film that I did had to do with health, and your digestion begins, in your mouth. That's where, and so I started to develop some health issues as a result of not chewing my food properly or not eating certain foods because they were difficult, and overall a lack of self-confidence. And so, so this was really monumentally a monumental shift for me. But what I really, I really want, I'm happy to talk about any experience, anything you want me to talk about regarding the experience. But while I'm here and while I'm with Dr. Graves, is that what he's talking about, my interpretation and my experience, aside from the dental stuff, right? My personal and spiritual experience, if you will, is that what Dr. Graves is exhibiting is a really refined level of consciousness, right? Because this isn't a business model. It's a reflection of a particular kind of consciousness that is dedicated to unifying rather than displacing, and cutting people off. Because everything he does has something to do with unifying, right? That woman that you just saw, right? Like, it's going to help her make her family experience more cohesive, her experience with her friends as well. And so it's this exponential thing, that whole butterfly concept, right? The butterfly on the other side of the world. And so, it's to me, it's like if more people in the corporate world would adopt this way of conscious capitalism, talk about changing the world. He certainly individually changes people's lives every day. But imagine, the collective experience of that kind of benevolence, the impact, the global impact of that kind of benevolence that comes almost as second nature to him. He's a very unassuming guy, that experience has rekindled an inspiration. It's inspiring. It's a rekindled an inspiration in me that I thought was a little dormant, really. That it's sort of after watching the news for 15 minutes, being around him, you get to, and his staff. Oh, not everybody's an idiot, not everybody's like, there's hope in this world. So, so it wasn't only a dental experience, it was a holistic experience. It was like a full on, not only a physical, but really it impacted me emotionally and spiritually, being in that environment. Because everybody on his staff, everybody on his staff carries this frequency that, they're happy about where they are. They enjoy what they're doing, and they're very friendly. So anyway, did I go on too long? I hope not.
No, Frank, you made a great point. And watching Ruby's video as well, life changing. It's like night and day. Dr. Grizz, my question is, when did this start? Was it Louisville? Was it Kentucky? Was it after? Was it in oral surgery residency? Was it when did this passion for life transformations begin?
You know what? I just love doing oral surgery, right? When I was in dental school, I went to oral surgery because I remember when I was in clinic, the oral surgery was fun to me, right? Dentistry, I would enjoy doing. You have a great life. Don't get me wrong, but it probably would have felt like a job to me being a general dentist versus oral surgery, which is fun. I enjoyed going to the clinic, and I thought to myself, man, why not just do this for a living? This is fun. And to this day, I'll be doing surgeries and I'll think to myself, man, I would do this for free. I can't believe somebody's actually paying me to do this. This is fun for me to do. I'll do this for free. So, I enjoy doing the surgery. And I think coming from like a humbled beginning, being a kid who was on Medicaid and not having things, it really gives me some compassion for these people. I understand what it feels to be poor. I understand what it feels not to have money to pay your rent and pay your electric bill. I've been in college where I didn't have my electricity. I had it turned off because I couldn't afford to pay it. I've been in these people's position. And there's some inalienable rights that people should have. And I think one of those things is healthcare to a certain extent. We live in the richest country in the world, and we have a guy that has a tumor growing in his face for 2 years, and you can't find somebody to cut that off, and then potentially he could die for something like this. God forbid I take 2 hours out of my life to do something for free to change this guy's life. I enjoy doing those things, but I feel like a certain responsibility as a human being and to society to use the God-given skills that I have. I'm very blessed to be an oral surgeon. A lot of things had to happen in life for me to get, away from where I was. I'm far from where I began. And I think to myself, nothing was handed to me. I got lucky. I'm blessed to be where I am. And I owe a certain responsibility to life to pay back some of the blessings that I have upon myself.
Dr. Grace, I've been following you for quite a while, TikTok, Instagram, the whole deal. And I must say, you not only have a talent for life transformation, but the way you market it too, you're putting it in the perspective of a leader where you're showing like, this is what you can do with your talent. And this is how you should give back to the world and lead forward in the sense that, show that you're doing these things, show that other people can do it as well. It's not only wisdom teeth, it's not only implants all day. It's about life transformation. It's giving back, and you are the leader at the forefront of that from everywhere that I've seen. And we got a lot of great, I don't want to call it influencers, but there's a lot of oral surgeons on social media making a lot of headway. But I see you as a leader in the giving back atmosphere, and that's just so impressive. I have to throw that out there. And Frank, you're the testament to it. How are the new wheels looking?
Well, I've already got 3 calls from Hollywood. There's a battle going on from my audition.
Mm-hmm.
No, it's like, it's when people get emotional about, the patients get emotional. It's like, when you've suffered a long time and you've been, you kind of endured it, and then all of a sudden it stops. What happens is that you're like, like all that endurance that you've put into compensating and overcompensating for this issue that's caused you, a lot of grief, and all of a sudden it's taken care of, and in the exhale comes like just the emotional release of all that angst that you've carried all that time. You know, it's not just, it's why it's holistic. It's a really a complete experience. You know, and you know, as a guy, you try to, you know, shield the public from your feelings because of that stupid socialization, that whole macho BS thing. But really, it's like, it's really been an emotional day. I've been feeling kind of, you know, silly about expressing it, but man, it's like, it's a major thing. You know, it's almost like getting an appendage back. You know, like if you were missing a finger or an arm, and all of a sudden it's back there. You know, it's not a phantom anymore. And you know, but the heart that comes with it. You know, people. I believe that people have forgotten the joys of generosity. They're so afraid of losing theirs or not getting what they want that they have forgotten. You know, they had forgotten the joys of generosity. Generosity is a very joyful thing. You know, that's service is really what it's all about. Any serious spiritual practice, any one of them, at the core of it is service, right? Helping somebody that really can't do anything for you, right? Not, you know, you see these people in Bill's videos, you know, like they're not so-called influencers, a term I've learned to despise, by the way. You know, but it's not like they have a whole bunch of people on TikTok or anything. He's helping people that really, they materially can't give him anything. But what does happen as a result is an expansion of heart and an expansion of consciousness and a sense of purpose and well-being that you can only get by being of service. You know, it's a really elevated state of consciousness, you know, that, you know, I personally, I don't know for sure, but I believe that, you know, that one way of getting there is having gone through the dark nights of the soul and coming to the other side of it with empathy rather than contempt, which takes a warrior heart. You know, Bill's a warrior, you know, he's a warrior without a rifle. Well, he's in Texas. He's probably got a gun somewhere, but you know, you know, but that kind of generosity takes the heart of a warrior, you know. So he's, you know, it's an example.
Well, good. Thanks, Frank. He said everything we rehearsed. He said, "No, I'm just joking." We didn't. Well, good. I know we usually have about an hour time limit on Zoom. Is that right? So we're getting kind of close here. You guys have any last minute questions or anything? No?
Dr. Ayers, I have too many questions to ask. I mean, I want to get into the nitty gritty with oral surgery, but if it's possible, perhaps we could pick this up at a later date. I know, sure. We're looking at 10 o'clock on the East Coast now. I know a lot of people have to get ready for classes tomorrow and whatnot.
Yeah. And look, and people I get people shadow all the time. You're welcome to come to Amarillo sometimes if you want to. I have a girl from an oral surgery resident from Chicago coming next week. We have a faculty member from Penn come in the week after that. We have people in all the time. I mean, it's a free open for people to shadow. I've had kids come from Egypt to come shadow me. So, I mean, we welcome people to come to the office as well, kind of see how we run the operation.
Oh man, well, I was going to ask that. Now it sounds like I have some competition.
No, anytime you want to come, brother. Anytime you want to come.
Absolutely.
And if I'm on the show again, I want a higher chair. I look like a midget. Like
I know. I look humongous compared to you. All right,
I look
guys.
like Danny DeVito.
Thank you guys so much for joining us tonight.
Awesome, guys.
I'm really taller.
Yeah. All right, thanks, guys. If you have any questions, you guys can send me a message on Instagram, not TikTok, because we get 1,000 messages a day on TikTok, and impossible to go through them. But on Instagram, I go through those. All right.